Before I begin, a little bit about me for context. In addition to my recently completed PhD from the University of Kansas, I also have a Master's of Science in Geography and a Master's of Urban Planning, which I pursued concurrently as part of a joint program between the Department of Geography and Atmospheric Science and the School of Public Administration and Affairs. One thing that really struck me was the lack of communication between these departments. Over here, you had people doing research on land-atmosphere interactions, but the research wasn't directly informed by need or practical relevance. And over here, you had people who needed to understand the implications of land use decisions, but weren't engaged with current research. We have so many valuable resources for understanding the functioning of urban systems, remote sensing being primary among them. But if the information is not communicated to those who can make use of it, and in an accessible manner, the work is incomplete. Research should be more than simply the extraction of information from data. I seek to also construct meaning from information through communication and engagement to produce actionable insights. For my talk today, I will first give a brief introduction to urbanization and why it's important to understand its effects. I will discuss the role of vegetation in decreasing urban heat. I'll describe how the physical environment of cities interacts with the social environment and how this affects public health. And I will end by discussing how the insights from these projects can inform action to equitably improve people's lives. In the late aughts, global population shifted to being over 50% urban. That's over 4.4 billion people that live in cities. This number is expected to double by 2050, at which point nearly 7 of 10 people will live in cities. At the same time, climate change is reshaping our world. Mean temperatures are rising, and the frequency, intensity, and duration of heat waves are expected to increase. Heat is the #1 weather-related killer in the United States, and globally deaths related to extreme heat are on the rise. These intersecting forces of urbanization and climate change are requiring that we look at cities in new ways. While urbanization is generally seen as a positive force for human development and poverty reduction, unmanaged urbanization has the potential for environmental degradation and inequitable sharing of beneficial outcomes. Building cities that work for everyone requires research that can provide clear insights and impacts. Urbanization profoundly changes landscapes, the atmosphere, and societies in ways that will interact with climate change, affecting resilience, health, and equity. Globally, the total urban footprint is predicted to increase by well over 100% by 2050, and cities are warming faster than global mean temperature. The process of urbanization alters the Earth's surface, replacing vegetation with impervious surfaces like concrete and asphalt. These changes modify the way energy from the sun moves through urban areas, with buildings and roads absorbing and releasing heat, and the lack of vegetation preventing that heat from dissipating through evaporation. As a result, urban areas are frequently hotter than rural areas, a phenomenon known as the urban heat island effect. There is a great deal of variation within cities as well, with some neighborhoods being much hotter than others. And it makes sense that neighborhoods vary in temperature because clearly not all areas are alike. Here are 2 neighborhoods in Kansas City with vastly different physical contexts. These are images of Kansas City with the 2 neighborhoods from the previous slide highlighted in red. This is an image showing the concentration of buildings and roads. Here is an image showing the distribution of vegetated surfaces. And here is an image of land surface temperature, with hotter areas shown in orange and cooler areas shown in blue. You can see that the areas with a high concentration of roads and buildings are hotter than areas with more vegetation. So what can we understand about the pattern of the urban landscape and how it relates to temperature? Is there some kind of concrete advice that we can give to planners to ensure that all areas of the city are effectively mitigating urban heat? To answer these questions, we used statistical models and data derived from satellite images to estimate how the pattern of green space affects land surface temperatures given a set amount of vegetation. So basically, if half of an area is covered by green space, are temperatures reduced more if the vegetation is clustered all together or dispersed throughout the area? And the answer we found was no, the pattern really doesn't matter. While there are some vegetation patterns that offered very small improvements, absolutely what mattered the most was the amount of vegetation. In this graph, the different colors represent the percent of an area covered by vegetation. The LST anomaly is the difference between the land surface temperature in an area and the median land surface temperature for Kansas City. You can see that as the percent of vegetation increases, temperatures fall below the overall median temperature. Simply put, more vegetation equals lower temperatures. And this is actually great news because it means that limited resources can be targeted to areas where vegetation will have the most impact, not just in terms of mitigating heat, but also of increasing environmental justice. And environmental justice considerations matter a lot. Cities are not static, but constantly evolving physical environments that are structured by history. Here is a map from the Homeowners Loan Corporation made between 1935 and 1940. Neighborhoods were graded on, among other things, the racial and ethnic identity and class of residents. Areas with the lowest grades, shown in red, were deemed hazardous for investment, a process known as redlining. Our two neighborhoods are shown again here, highlighted in red. Residential segregation, redlining, urban renewal, highway building, and discriminatory siting of hazardous facilities all have contributed to significant inequities in environmental exposures. In addition to environmental exposure, other social determinants of health like racism, income, and neighborhood context all affect community health risk. Life expectancy data from the Robert Wood Johnson Foundation helps us see how environmental exposure and other social determinants of health are co-located in the Kansas City area. The Armour Hills neighborhood has a life expectancy of 83 years. But less than 3 miles away, the Blue Hills neighborhood has a life expectancy of 69 years. These neighborhoods differ in other key ways: the density of built infrastructure, land surface temperature, racial composition, and the density of acute pediatric asthma cases. The Blue Hills neighborhood is hotter, more built up, is a neighborhood of color, and has a higher density of acute pediatric asthma. To address these disparities in environmental exposure and health, I assembled an interdisciplinary team at the University of Kansas and collaborated with researchers and health professionals at Children's Mercy Hospital and the Center for Economic Information. Children's Mercy provided address-level data for acute pediatric asthma in the Kansas City region through KC Health Corps, a data repository to facilitate environmental health research. Through several months of meetings and the establishment of a formal research protocol, we established mutually beneficial research goals, including contributing processed environmental data in an easy-to-use format to KC Health Corps, describing the relationships between environmental exposure and acute pediatric asthma, and publishing the research in a peer-reviewed journal to help acquire continued funding for the project. Additional goals include identifying leverage points in the urban environment and communicating this knowledge in ways meaningful for the creation of effective public policy. In brief, asthma is a chronic inflammation of the airways and is the most common chronic condition of childhood in developed nations. Overall rates of pediatric asthma in the United States have decreased, yet racial disparities have increased, with poor and minority children suffering higher rates of occurrence, morbidity, and mortality. We looked at the total counts of acute pediatric asthma incidents over 10 years for each census tract in the study area. This aggregation allowed us to both protect patient privacy and investigate how neighborhood context affects health. This map shows the pediatric asthma rate per census tract relative to the overall rate for the study area, with higher values indicating higher risk. You can see that risk is highly concentrated, and the following slides will illustrate how this spatial pattern is mirrored by characteristics of the urban environment. This map shows the proportion of vegetated cover per census tract derived from satellite imagery. Vegetation has the capacity to reduce temperature and decrease air pollution, both of which have been shown to affect asthma. Also derived from satellite imagery, we have the average land surface temperature of each census tract on top and at the bottom, average PM2.5 concentrations, which are fine particles of air pollution from exhaust and other sources. This data comes from the Center for Air, Climate, and Energy Solutions at Carnegie Mellon University and has been divided into 5 categories, with one representing the census tracts with the lowest PM2.5 concentrations, and 5 the census tracts with the highest concentrations. Extremes of heat can directly affect asthma by causing constriction of the airways, and indirectly by influencing concentrations of air pollutants and allergens, both of which are associated with asthmatic symptoms. These climatic and environmental factors are distributed differentially across socioeconomic groups, in addition to the fact that marginalized communities may be characterized by increased vulnerability. These data come from the U.S. Census Bureau. The top map shows the proportion of residents living below an income to poverty ratio of 2, indicating financial struggle, while the bottom shows the proportion of non-white residents. When viewed all together, you can see distinct spatial patterns of exposure, vulnerability, and risk. In order to assess the strength of these relationships, we used a statistical framework that allowed us to examine a range of possibilities and how likely those possibilities are given the data that we used. We found that there was a strong relationship between the proportion of non-white residents in a neighborhood and the number of acute pediatric asthma cases. In this graph, you see the differences in this relationship for neighborhoods categorized by their racial composition. These are probability distributions representing the range of likely values for the strength of the effect compared to neighborhoods with the lowest proportion of non-white residents. If a distribution were to cross the vertical line at 1, it would indicate no effect. The higher the value along the x-axis, the stronger the effect. What is important to take away here is that the higher the proportion of non-white residents, the stronger the relationship with asthma, indicating that neighborhoods of color are disproportionately affected by negative asthma outcomes. We also found that in neighborhoods characterized by high PM2.5 concentrations, an increase in the proportion of vegetated cover decreased asthma counts, and that this effect was stronger in neighborhoods with a higher proportion of non-white residents. So not only does increasing the amount of vegetation in an area effectively decrease temperatures, it has the potential to reduce asthma burdens in high pollution neighborhoods, and in particular neighborhoods of color. Our analysis provides information to better understand what may be driving asthma disparities in Kansas City and what might be the best targets for policy and intervention given the unique context of the problem. These results can fuel ongoing research and equity-focused quality improvement within the Children's Mercy Health System. In fact, researchers there are working on an Envirome app to show a patient's home environmental context when they are admitted for care. Ideally, they will incorporate our data so that practitioners can see whether a patient lives in a hotspot for certain conditions or are possibly exposed to greater environmental risk connected to population health disparities. Additionally, they are looking to use our methods to guide features of the app for presenting the distribution of health data in a meaningful way that would help to illustrate place-based disparities and to guide users to explore the data and investigate possible modifiable factors related to environmental context. And that, of course, is the point of research. Knowledge for the sake of knowledge is not enough. We are lucky enough to do this kind of work, using fascinating data to learn about our fascinating world and generating insights that can benefit both people and the environment. Research and results should be interpretable, impactful, and actionable. Well-managed urbanization can promote health, justice, and sustainability, as well as resilience in a changing climate. Understanding the functioning of urban environments in the present can help us build better cities for tomorrow, and research such as this can provide the evidence necessary for urban practitioners and communities to do just that. Thank you.